Hi everybody, this is Joshua Goldstein here at Integrative Acupuncture Center in Ridgewood, New Jersey, and today I wanted to share with you an exciting case of a Bell's palsy patient that I had treated. I had a patient come in at the end of September. He had complained with me. He was 34 years old. He worked in one of the restaurants as a waiter in Ridgewood, and his boss, who really had a good relationship with him, had called him and said, "Can you do anything for my worker? He's developed Bell's palsy." Bell's palsy is a condition which causes paralysis, temporary paralysis of the face. In his case, he had trouble affecting the right side of his mouth. He had numbness in the area of the cheek. He had trouble chewing. He could not get the food to fully chew on this side, so he would have to use his fingers to remove any of the food that was stuck behind his cheek. He also had drooping of the mouth, which caused water to fall out when he drank, so he had to be very careful to drink from the left side. His eye was very droopy, and he couldn't fully close it, so he was concerned about eyesight issues, and he also had very dry eyes and irritated eyes, as he had to use drops to keep the eye from getting too dry, and he needed to moisten it. He also had his laugh line was dropped. He had difficulty raising his eyebrow. He shared with me that he worked in the restaurant business, and this affected his appearance. He was very self-conscious about how he looked. He had no idea about acupuncture, but was willing to try. I treated him twice a week for 7 visits total. I started on September 17th, then we treated him on the 20th, the 23rd, the 27th, and the 30th, and then we treated him on the 4th of the following month of October. By visit 3, he started seeing his cheek to activate. He could chew a little bit more. Food was still getting stuck there, but much less. Swallowing water became easier and didn't just drop out of the mouth on that side. By visit 4, his eye had almost fully regained closure. It was just a little crack in the eyelid, and he couldn't fully close that. And the lip at the midline was starting to droop upward. So we treated him till we did the final visit, and by that time he had total resolution of his symptoms, and we had done mainly points in the arms and the legs that signal to the brain to affect the area of the cheek, head, and the face, as well as to the forehead, and we treated him frequently. We did about twice a week. Some people I do 3 times if it's very severe, but the earlier you treat it, the better. In about 15 to 20% of cases, there can be some long-term nerve damage, and those cases are much harder, and you can't fully regain the effects of the musculature, but you can make a difference in getting degrees of it better. So he was very happy with the treatment. By visit 4, he was feeling much more confident and relaxed with the needles, because they're not like typical needles that we're accustomed to, which is typically injections that really hurt. And so he was actually finding that this was very relaxing and very helpful for his face. So we did actually use a few small needles in the areas of the cheek and in the forehead to encourage more blood flow, to help stimulate the nerves so that they could heal better. So that was a great response from what we did with simply 8 visits. And he was very happy with the results. If you or you know someone who's suffering from Bell's palsy or would like some help with this or some other issues, feel free to call me. I'm here to help. My number is 201-444-7150, or you can email me at joshua@acupunctureyes, that's yes.com. Thanks so much for watching. This is Joshua Goldstein, everyone's favorite acupuncturist, saying bye for now.